If you think you have an idea, reach out, do the application, do your design thinking workshop, have confidence in yourself and in what you want to put across. And if you're not successful, going back to the drawing board and thinking, how can I do it differently to make it successful?
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Noreen Turley, and today I'm joined by two exceptional guests from the HSE Spark Innovation Programme. We've got Caitriona Heffernan, National Clinical Innovation Lead, and Anne-Marie Kiernan, National Nursing Midwifery Innovation Fellow. Together, they're at the forefront of empowering frontline staff to shape a more innovative, responsive and compassionate health service for all of us. So welcome today, ladies.
Thank you, Noreen.
Thank you, Noreen, for having us. Lovely to be here.
Great to be here. Thanks, Noreen.
Yeah, so Spark Innovation is something that I came in contact with or heard about a couple of years ago, and I was really interested in it. And I didn't realise there was something like HSE Spark Innovation. And so maybe, Caitriona, if I go to you first, can you tell us a little bit about Spark Innovation, how it started and what it's all about, really?
Sure, absolutely. So HSE Spark Innovation Programme started in the National Doctors Training and Planning Office in 2017. So the National Doctors Training and Planning Office are the office inside the HSE that are responsible for the training of the doctors that work inside the system. And it was born as an idea to empower and enable the junior doctors in training who are rotating around the country to be able to engage in innovative practice wherever it was that they landed. Because, they reported back that they heard or saw challenges that were recurring right around the system, and they wanted to be active agents of change and get involved in addressing some of those challenges. So the HSE Spark Innovation Programme was born then in 2017 and gave out really tiny amounts of funding to the doctors on their training rotations to help them to be able to activate those changes that they wanted to do on the ground. And since then, I suppose the popularity of the programme has grown. And we were delighted then in the subsequent years to have new stakeholder involvement from the ONMSD, which is the Office of Nursing and Midwifery, and also the HSCP office, so the Health and Social Care Professions office. And then just this year, actually, we have the first Innovation Fellow in Pharmacy as well. So cumulatively, that means that we are open for business for any healthcare professional working at the frontline of Irish healthcare. And we support all of those clinicians working across the Irish Health Service to be able to develop and implement their innovative ideas for the benefit of patients and citizens at large.
Okay, so when you say you support them with innovation, what does that actually mean for our listeners on a day-to-day? Is it that they have an idea? Is it they have to get a group together? What do they have to do?
Yeah, so their entry point into the programme generally does start with an idea, but ideas by themselves really aren't worth anything. Ideas are 10 a penny, technically speaking. And so it's what we do with those ideas and how we act on those ideas and how we navigate implementing those ideas. That's really what makes innovation. So people can come independently to bring an idea forward with a plan for implementation, an idea of how they're going to develop this idea and put it into action on a small scale, maybe as a test or a pilot or a proof of concept is what we might know those activities as. And we do deal with people individually, but certainly we find that it's very difficult to implement any innovation on your own. We work as teams across the health service, and trying to deliver innovation is no different. It generally is a team sport. And so even if we have independent applicants that come forward to us, they tend to have other people working with them, either on their idea or as part of their idea. And I suppose you asked me, what does that support look like? So for us in Spark, sometimes that is giving them access to funding to be able to develop their idea. But alongside that, I suppose critically, is the mentorship that people need in order to be able to develop and deliver their innovative ideas, and the long-term education that might go with developing innovative ideas as well. So we're very much about not only delivering the innovation in real time, but also building that capacity and capability across the system for future activity.
Yeah, no, that's great because it's the idea, but you need the people around you then to really make it work. So you support them with that. And Anne-Marie, just bringing you in there, what inspired you to get involved with Spark? You're a nursing fellow, which is a very posh title. What does that actually mean?
So what a fellowship is, it's a 1 year to 2 year opportunity to be really immersed in the Spark programme and to learn from the inside what the intricacies are with regards to running initiatives and to supporting projects and to developing skills around, we'll say, what is required in innovation with regards to design thinking, networking, collaboration. Like there's several pillars we work under. And really it's about pioneering the programme and being a voice for people in the front line, because any of the fellows have come directly from the front line and they're a representation, one, of what frontline workers are and have potentially had to overcome to do innovation. But equally, you're representing the programme itself and what's feasible when you actually become part of the programme. It's funny because my Spark journey actually started with an application to Spark Seed where I wasn't successful purely based on the fact that I didn't have that literacy piece. Like, the innovation language is very different to what we're used to in the clinical world. So the recommendation on my feedback was I would advise you looking further into learning about innovation and advise looking at the postgraduate diploma in healthcare innovation. And I did. That's when it all started, because it was around COVID, the time when all innovation really started to take off. And it was learning this different mindset, that looking at a problem with a different set of goggles, that it wasn't about thinking outside the box. It was imagining there wasn't a box, like creating a solution with no barriers and then identifying what were the barriers you had to overcome, rather than designing, including the barriers, which I loved. And it was encouraging you to think and encouraging you to be integrated into healthcare and creating the solution. Because people on the front line are the ones who are experiencing the problems. So why wouldn't they know what the potential solution is? And that's what Spark is really all about. And that's what I love, that mindset of seeing value in the person on the front line, what they can contribute, and investing in that and giving them the confidence to have a seat at the table to define what healthcare really should be.
Yeah, it is incredible, really, the whole process of it. And when we're talking about that then, can you explain to us a little bit, Caitriona, about what are the qualities that somebody needs to have to be an innovator? Are innovators born or are they made? Can you teach somebody to be an innovator, or is it an instinctive thing that, like Anne-Marie was told, oh, you could do this if you did X, Y and Z, and she said, okay, well, hell, I'm going to do that, and she went off and learnt it and she got the language. How can you explain that?
Yeah, so that's a long-standing debate, Noreen, and we could talk all day about whether innovators are born or made.
Yeah.
But I really think that in all industries, and certainly in healthcare and certainly in the Spark programme, this idea of these lone innovators, these Steve Jobs characters or these Elon Musks, regardless of what we think about how they operate in the real world, there is this kind of perception that you have these lone geniuses locked in a room that come up with these great ideas. And actually what we find when people are trying to develop innovations inside a complex system like in healthcare, that actually you need a multitude of skills, talents, characteristics in order to actually execute an idea. So like I said in the early part of our chat, ideas are in a way easy to come by. And we know there are plenty of challenges within healthcare. So it's not difficult for us to identify gaps where we think we could maybe bring something new to the table that's going to add value for patients and for the public. And of course, for our staff members as well, the people around us who are trying to deliver healthcare. But really to take that idea and carve it into something that can feasibly be delivered inside the health service and also that can be sustained in the longer term, that takes different types of people with different skills and characteristics.
Yeah.
So there's no doubt you need that ideas person. You need that person who is going to come up with the great idea. But generally speaking, we know that people who are great ideas people often are not great implementers. So they're going to need the person behind them who maybe isn't full of the great ideas, but is that real workhorse of a person, the person that won't give up on something when they've decided they're going to do it until it's been fully implemented. That's the magic, that's really the package that you need in order to be successful in healthcare innovation, to have all of those people around you, behind you, beside you on the journey from that idea right up to the implementation and sustaining.
Yeah, no, that makes sense. So Anne-Marie, we've talked a little bit to Caitriona about whether innovators are made or they're born, and you wanted to come in there a little bit on that one?
Yeah, I think with the Spark programme, you're honing in on skills that frontline workers already have. When you look at what the roles of frontline workers in healthcare are, it really formulates around nearly project management already. That there's service user engagement, there's communication skills required, there's data analytics in order to improve care. Like, these are all key skills that frontline workers already have. Honing in on that and trying to support them in order to improve care. So really you're honing the skills they already have and supporting it more through innovation through the Spark programme.
Yeah, okay. So Caitriona, innovation is such a huge word. What types of innovation is the Spark programme supporting throughout the health service?
Yeah, and even the definition of innovation, Noreen, is very different from industry to industry. And if you asked other people inside the health service about what innovation is, you're likely to find different answers everywhere you look. And that's normal. We all interpret innovation differently. Ultimately, it's about delivering something that has value, that is novel, and that you actually act on, that it's an idea in action. So that's really important. Because of where we're situated and because we're just as interested in delivering great solutions as we are in delivering future capability and, helping staff to develop their skills around innovation. So learning is a big part of what we're talking about too. The system around the country is very different and people have different skill sets. You have some hospitals, for instance, that are digitally enabled already. There are other environments that are coming on to being more digitally enabled. So that kind of changes the fabric of the types of innovation that you might see in different parts of the country. So we're very cognizant of that when we're supporting innovation. And as a result, our portfolio, if you like, of the innovations that we support is very, very varied. So often you can have innovations that are much more incremental in their nature. So it's something that already exists in the system and you're changing it slightly. Maybe there's a small improvement to what's already there. And that might be for people, who are in the earlier stages of dabbling in the world of innovation. Maybe they don't feel they have the skills yet or the confidence or the capability. And so they can be working in those more incremental spaces. Then you have more optimized types of innovation where you might be bringing in a digital solution on top of a service that is already in existence, or you might be doing a service redesign in order to be able to make something better. And then on the other side of the spectrum, you have much more those disruptive or radical types of innovations. Inside what we've seen, and which has been a real pleasure to witness over the years, is that transition now from primarily a lot of the innovation being in that incremental or optimization stage to seeing these clinicians coming back again and again with bigger ambitions, greater abilities, and looking for that support in order to deliver things that are much more radical and disruptive to the system, new AI solutions, using robotics, a lot of kind of very exciting adoption of the traditional types of innovation that we might know and read about online and things that might blow our minds. Those are happening inside our health service, delivered by our own people, which is just, amazing to see that people have developed that level of skill and also that level of ambition.
Can we get a few examples of innovations, Caitriona, maybe that you've done over the last while? And I know Anne-Marie has been involved in a couple of innovations as well, and I'll ask her, but I know it's not fair to ask for your favourites, but ones that have stood out to you maybe and that have had a biggest impact, even over the last year.
Yeah, well, I suppose the first thing to say is that we are merely the supporters of these activities. So it's not necessarily projects that we've worked on. It's projects that we're supporting those frontline workers who come to us with ideas in order to work on. And we're very clear about that. We're so, I suppose, humbled and honoured to be able to support people who are really working at capacity in their clinical roles and then make time for doing this activity as well. But every year we award some of the exceptional projects that we see active out in the systems. Maybe it would be helpful if I ran through just a very brief overview of a few that we awarded this year at our Spark Summit. So they're really wide and varied. They can come from all sorts of settings, community settings, acute hospital settings. They can be based around different methodologies. So bringing in new technologies, projects that are developed with patient partnership, very much with patients at the centre, co-creating solutions. So there can be a lot of different types, but just to give you some examples this year of some of our award-winning projects. So we had a fantastic project by a clinician that actually won the CEO's Innovation Choice Award, and it was there to help patients to be able to increase their access to community support. So this was a project that was around seating needs for children with complex needs. And I suppose traditionally what tends to happen is we know there can be centres of excellence in the country, which is fantastic in terms of making sure that we're able to engage with the right type of care, the right specialist care when we need it. But from a patient experience perspective and from a family experience perspective, that can be really difficult for patients to have to move around the country in order to be able to get access to those specialist skills. So this particular innovator came up with a great idea about being able to develop those seating, that seating equipment and address those seating needs for children locally to their own homes. So, she has developed that deep skill and capability that's required to provide that exceptional service, but she's now providing it in the location where children live so that the families don't have to miss school and work and, be away from other members of the family to make their way to, I suppose, those central settings around the country that would traditionally have met those needs. So that has a huge impact in terms of the patient experience, but also ensuring that patients are getting that exceptional service need when they need it. Another one would be, we'll say, in the acute hospital setting where consultant doctor came up with an idea of a virtual obstructive sleep apnea clinic. So again, instead of patients having to actually make their way to the hospital to undergo overnight assessment for obstructive sleep apnea, this can now be done at home where they get the equipment sent to them. They're able to sleep in their own beds at home, carrying out the assessment that needs to be carried out in order for them to get their clinical diagnosis. That diagnosis is able to be made remotely. And I suppose, in the world that we live in now, people expect that from their health service to be able to access services like that, to be able to access services in their own home, for things to be more convenient. But of course, because we're working inside the health sector, always ensuring that that service is clinically sound, that nothing is being removed from the care aspect by allowing us to kind of adopt these new technologies and new ways of working. So I could give you plenty more, Noreen, and I'm happy to do so as we continue.
Yeah.
But maybe that's enough for now, just as 2 examples.
Yeah. And Anne-Marie, tell us a little bit about your project. Did you win an award at the Spark Innovation Summit?
Yeah, I won a Bright Spark Award in June 2025 as well for my project at the time, which was Patch Me If You Can. So I offer a pain treatment for patients, which can give up to 12 weeks of pain relief. But unfortunately, it can induce a pain response, especially during application, which requires an hour of application. So the longevity of the benefits is really reliant on how well they tolerate it. So I was using an augmented reality headset during treatment, which reduced pain scores by over 50%. So that's the use of a specific type of headset, which creates holograms in the environment. It was a fantastic project.
To me, it was like an example of they were playing a game on a computer and they had this headset like that. And then the images go through it just so the listener can get an idea of it. So
there's 2 types of reality, really, virtual reality and augmented reality. Virtual reality is when you put on this special digital headset, it creates a complete virtual world that you're completely immersed in. While augmented reality, you put on a very similar headset, but you can see your environment. It's just you have holograms within it. So that's the headset I was using with patients. So they felt safe within their clinical environment. They knew where they were, but you just had kind of these holographic games integrated into it. And it worked fantastic for distraction purposes for those who were able to use it. But really for those who couldn't use it due to physical limitations or due to cost, especially in the home setting, I really wanted to look at how can I improve on this? And it was through Spark I was able to progress the project, which has led now to a virtual reality based program that can be used at home using your mobile phone with a mobile phone mountable headset that only costs €43 per patient for 6 months. So it's affordable virtual reality. So they gave me the platform to develop my idea further and address the limitations that I'd had experienced from my last project.
Oh my God, that sounds fantastic. And I'm sure this is upscalable, is it, Emery?
Yes, completely, Noreen. So at the moment, I'm looking at cases in the intensive care setting to try and normalise that transition from intensive care to the ward setting to home, to the area of paediatrics for uncomfortable procedures that they would undergo in the units, and also in labour and delivery for labour-related pain. And at the moment, I have case studies running in each of these areas. So the aim is to try and scale it further in these areas.
That's great. So you just keep assessing it and upscale it. And if people are interested, I guess they get in touch with you or get in touch with Spark?
Yes, either or will get access to me, and then I'll work with those areas in order for supporting of the procurement piece and let's say the documentation needed in order to support its use in those areas.
Very good. And Caitriona, is Spark the only place in the HSE doing innovation, or is there pockets of innovation going on around the country?
Absolutely not, Noreen. We're one part of a huge ecosystem of parts of the organisation that are involved in innovation. And I think that's a really important piece, just like I was talking to you earlier about, the different types of people that are important to the innovation process. The different stages of the innovation process are just as important. So what we do in Spark, and I think what is quite unique for our activity, even internationally, is our close proximity to the front line, to the people who are actually delivering services every day. So one of our rules of engagement, if you like, is that when people come to us with an idea, there has to be a clinical person who is the main driver of the team. So that's how we ensure that we always have clinicians' opinions and ideas there at the forefront of what's happening. And our role inside Spark then is to support those people to get their proof of concept, to do their pilot, to do their test in their own site, in their area of clinical experience where they have access to the patients that they want to work with and for, and they deliver it in that setting. what happens after that then, of course, is that it's really important that, just as you were saying to Anne-Marie there around scaling solutions across the country, if something is giving benefit in one part of the system, of course, it is logical and ethical that we make sure that that type of service is available for everybody across the country. So that is something that we're not staffed for inside of HSE Spark. And it's also something, I suppose, that sits outside of Spark in terms of those decision making. That's a broader organisational decision. And, that sits with the regional executive officers now in the new regions across the health system.
Yeah.
And I suppose more broadly then with the senior leadership of the organisation identifying what are our big challenging areas and what do we need to sustain or to try to transfer across the system. So certainly not. And I think, for instance, it's really important to say that digital solutions, for instance, where we're bringing in new digital solutions, it's very much part of the future of the healthcare story in Ireland that we're moving to a digital first type service. And so, we don't actually act a lot in the digital space. We're certainly there as a support. We're certainly very big advocates of ensuring that clinical people are very close to those digital solutions as well, as they are the people who will be both delivering them at the front line and also convincing patients and building trust in those systems for patients to engage with. So we still have very much an involvement in making sure that the clinicians are well represented in that domain and the patients are very well represented in that domain. But we certainly don't, if you like, own innovation. There's lots of activity and lots of pockets of innovation happening around the country. The trick is for us all to complement one another's work and work together towards the same goal.
Yeah, no, that's great because it's such a huge organisation, and to have all of these people and the way that you can kind of network with all of these people that can facilitate and help in different ways, it's great. And Anne-Marie, when you think about the journey you've been on, what has made the biggest difference in helping you bring your ideas to life?
Well, Noreen would say obviously from the mentorship and the guidance and like the financial support, Spark has been integral to my journey. But then equally locally, like having very understanding family and husband, very supportive friends. But I think having excellent managers along my journey have been really the definition of why I am where I am. It's one thing I really don't like is the word manager. Like I've never had to be managed. I have been led, I've been guided, I've been mentored, I've been counselled where I need it. And I know for a fact I wouldn't be in this position if it wasn't for the excellent managers that supported me along that journey to have me in the role I am. So that's why I'm very conscious that as a fellow, I want to give other people similar opportunities that I have had in order to support their ideas, support them developing confidence in what they can do. Because being honest, I could have stopped in my journey quite far back if it wasn't for a manager saying, give it one more try or try it this way.
Great. That's really good because I'm thinking about, I've got a nursing background as well, and the importance of having people to encourage you and to support you along the way is just, it's crucial, So what would you say to encourage nurses and midwives? They see themselves as innovators, or they'd like to be, but they don't know what to do, and they have these really good ideas and they know that they can do something to make a service better for our patients. What would you say to them?
Well, two things. One, I would say it's so important to reach out to like the stakeholders, the people who are involved in what you want to improve upon. Because if you don't have that engagement earlier on, you don't have those conversations, that could be the making or breaking of you implementing a project. And then reaching out to Spark, seeing what's possible. Like we run design thinking workshops that give you the opportunity to look and focus on your problem space and your potential solution and to expand on it further. And it gives you insight into what is actually expected of some of the applications that come in. And it could actually completely change your project. So I would definitely advise talk to people around you who are experiencing the same problem, but equally reach out to Spark to see what's possible when it comes to trying to actually delve further into your problem space.
Yeah, that's really, really good. One of the things I was thinking, what do you see the biggest challenges across the health service for innovation?
Well, I suppose there are probably two sets of challenges, one for innovators themselves and then one for innovation and what happens with innovation. I think we've touched on some of those things already, and Marie quite rightly there just pointed out the importance of supportive managers, are those enablers inside the system, those people who are going to open the door for you rather than close the door when you come to them with a solution. So for clinicians and for innovators in the system, I think it's actually capacity, the availability of time.
Yeah.
We often talk about, how your good ideas come to you out on a walk or in the shower or, that's where people kind of generally say that they come up with their big breakthroughs. And people are working so hard in the system and, their hours are taken up quite rightly delivering the services that are there for patients to access, that it actually very much limits not only their time to step back and reflect on something they've just seen and to identify an opportunity for it to be made better, but also critically, as Anne-Marie also alluded to, talking to your colleagues, talking to other people who are affected by that problem, to have that conversation about, is this just me? Am I the only person who sees that this is a challenge, or would other people feel that there's benefit to us addressing this thing that I've identified as a challenge within our service for our patients? So capacity, that kind of slack inside the system is something that's really hard, I suppose, to justify as well. We're all there, we're public servants, we're trying to deliver high value for our patients and our service users. So, it's difficult for us to stand over taking that time to step back and look at what we're doing. But it really is critical in order for us to be able to come up with really great, innovative solutions that have been stress tested and that have been validated and there's agreement on it with other people that are involved. That is a challenge, certainly. And it's not finance, it's not funding, that's available. I think the skills development as well. And we talked very early on in this conversation about it's just as important to know when an idea isn't a good idea as when it is a good idea. So developing those skills in order to be able to say, actually, good on paper, not so much in practice, or too many barriers in the way for me to develop this. So that's from an innovator's perspective. From the system and what happens to innovations, I'll keep that brief, but it's what we just talked about earlier around, what happens to these great innovations after they've been delivered in their first site. How do we make them available to other parts of the country? How do we encourage adoption and diffusion and the spread of those great solutions into other parts of the system? That remains a challenge and, that's a big priority for us now to address that.
Yeah. And just as you say that, Caitriona, I'm thinking about how do you talk to people who come with these amazing ideas? They just believe in it, and it's great on paper. And then when it's not such a good idea, how do you work with that and how do you explain that to them? It must be really difficult.
Actually, it's not as difficult as you might think. Clinicians are very reasonable people and they first and foremost want to deliver excellent standards of care for their patients. So while we all are in danger of falling in love with our own idea, that can be challenging sometimes for you to realise that something that you think is such a fantastic idea isn't necessarily felt by other people. And so we have had to build in ways of helping people, not necessarily for us to tell them your idea isn't a good idea. We much prefer to give them opportunities to come to that realisation themselves. So that can be through a number of different ways. So I think human-centred design is the methodology that we use inside the Spark programme. It's both a methodology and a mindset. But to put it very briefly, and again, we could talk all day about what design thinking is and what it brings to the health service. But ultimately, it's ensuring that the thing that you are going to change is actually, you're hitting the right challenge, you're hitting the right problem or the right gap in the right way for the people that you intend to make an improvement, have an innovation on behalf of or to co-create with. So that's a really good sense-checking way of working. On basic terms, it makes a lot of sense. It is literally having the conversation. Noreen, you're in today, coming into the clinic, coming for your treatment, whatever it is. And for a clinician to say to you, Noreen, we're thinking about changing up the way that we deliver services to make them better for patients. This is what we're thinking about. Would that bring value to you? Would that improve your experience? And having simple conversations like that can be really transformative in ensuring that we are delivering things in the right way. And then the other methodology that we use is that we teach this idea of desirability, feasibility, and viability for ideas. Essentially what that means, desirable, as the name would suggest, is it desirable for the system and for the people? So human-centred design is very much a part of that. The feasibility, can I physically do this? Do we have the infrastructure to do it? Do I have the supportive managers to enable me to do it? Do I have people around me who will help me to deliver it? And then really importantly, that viability piece. Can this be sustained in the longer term? So generally speaking, when clinicians learn this skill set of being able to critically analyse their idea and put it through that test, I suppose, if you like, that litmus test of does it pass the test of the desirability, feasibility and viability framework, if you like, they very quickly develop excellent skills at being able to self-navigate and being able to self-assess and make that judgment between good ideas and not such good ideas. That really is critical as well for innovation in the health service.
Great. So Anne-Marie, we're coming to the end of the podcast and I'm thinking, okay, I'm on the front line. I have this idea. And to be honest with you, I don't even know if it's innovation or not. But what would you suggest I do? I just have this idea that I know it can make the services better for the patients. What would you advise me to do?
Well, I think first off, you have to be confident in your idea and be open to closed doors at times, because every success that I've ever heard of was potentially once a failure where someone said, let's give it one more try. Seeing a closed door as an opportunity to redesign your innovation, to network further, to open up your channels of communication, but seeing every yes as an opportunity to build your confidence in your project. What's brilliant with Spark is we're not looking for big projects that need a lot of financial investment. We support projects from grassroots with Spark Seed that can be up to the value of €5,000, right up to Spark Impact, which can be from 5,000 up to 90,000. It can be education based with regards to design thinking. The possibilities are endless, and it really depends on what the need and the want of the innovator is. So if you're in any way curious about a potential solution, if you think you have an idea, reach out, do the application, do your design thinking workshop, have confidence in yourself and in what you want to put across. And if you're not successful, going back to the drawing board and thinking, how can I do it differently to make it successful? And it's just that confidence in the success story that's very important. Confidence in yourself and in your innovation, I think, is key.
Excellent. And people will find it on the HSE website, HSE Spark Innovation, is it?
Exactly. So all our initiatives are there, and there's often webinars with regards to certain initiatives. And as well as that, reach out to the fellows themselves. All our contact details are up on the website as well. We're always more than happy to discuss ideas, innovation, or even doing the fellowship itself.
Okay, great. Thank you so much, Anne-Marie. And Caitriona, we'll give you the final word. What do you think the future of innovation looks like in the health service going forward?
Yeah, so I suppose we can only speak from our perspective and what we know about clinicians and their willingness to engage with innovation. And, year after year, we are shocked and humbled by the number of people who step forward to engage in innovation despite their already heavy workloads. So certainly the future is bright if we're going to rely on clinical people across the system, because they just show up again and again, and they are determined to make the experience of healthcare better for their patients and for their colleagues. One of the great positives is how much we're moving more towards having patients and service users at the centre of what it is that we are developing. And I don't mean that about developing things on their behalf or with them in mind. It's actually co-creating, talking to patients, having them be part of the teams that are delivering and developing the ideas and interventions that ultimately are for them. So it makes sense that they would also be created by them. And so we're very lucky to have the patient cohort that are really interested in engaging with us. And I think that can only be a good thing. Then in terms of the system itself, what I would like to see and what I think is happening is much more of a kind of a circularity and a joined up approach to how we deliver innovation. So in the Spark programme, we always align our calls with the big priorities of the organisation, better access to service, better clinical outcomes for different patient cohorts. That always guides the types of ideas that we go out to the clinical community to look for solutions around. But that has really been doubled down on now inside the programme, because we're not only just looking to documentation across the health service to see where are the priorities, we're actually engaging very heavily with the senior teams that are responsible for the big priorities of the organisation and partnering with them around delivering very bespoke campaigns, looking for very specific types of innovations and responses to healthcare needs. So I see that as a real maturity now of how innovation is working inside the system. And my hope will be that over the coming years, we'll see so much more of that joining of the dots of us all working together towards a single outcome, which is to improve the service on behalf and with those patients and service users that we're there to serve.
That's really good. Thank you so much, Caitriona and Anne-Marie. So to our listeners, thank you for joining us on HSE Talking Health and Wellbeing. A special thanks to Caitriona Heffernan and Anne-Marie Kiernan for sharing their experience and insights on driving innovation in the Irish healthcare system. If you're inspired in what you heard today and want to find out more, go to Spark Innovation Programme, hse.ie/Spark. All the information will be there on how you can get involved.